Welcome back to Mountain Connections. I'm very honored to have Dr. Omar Morales here to talk all about how he is revolutionizing the treatment of Lyme disease. Dr. Morales, thanks for being here.
My pleasure. Happy to be here.
So you're the founder of Lyme Disease Mexico. Tell me about your journey to deciding to be a doctor, to practicing in Mexico, and focusing so much on Lyme disease.
Well, I really don't remember how I decided to be a doctor, but I can tell you that once I was a doctor, I got very interested in tropical diseases. It's a common thing where I live in Puerto Vallarta, and we see blood-borne issues that we usually don't see in North America, for instance. So in that crusade, I stumbled upon some research regarding blood infections, and slowly started to go down that rabbit hole of then tick-borne diseases, which is something rare for a doctor to really specialize or focus on. Most of the time you'll hear, there's a cardiologist, he focuses on the heart, or a liver specialist or lung specialist. But when it comes to infections from tick-borne, there's not that culture for us to say, are you a microbiologist, are you a doctor, are you a veterinarian, or what are you? So that really intrigues me to the date. And during that process, I got to know very interesting, smart people, both on the field of medicine as well as patients, other nurses, naturopaths. And it's a big collective world of knowledge that also very interesting, the fact that that knowledge is somehow not being spread out. And for several reasons that I'm here to talk about. This is somewhat a little bit of a mystery of an underlying illness that people forget about. Illness that most of the times goes unseen, like a ghost, the hidden illness, or a problem that really never gets diagnosed. You have that, and because you have that illness, as a consequence of that, you may develop other problems like neurodegenerative conditions, autoimmunity, psychiatric issues. So it's very vast, the world that revolves around Lyme disease, and that definitely intrigues me a lot.
So what are you doing? How are you treating your patients that present with Lyme disease? It's very individualistic treatment.
Correct.
How do you approach a patient?
Lyme disease has the characteristic that it has many molecules, many DNA carriers, and through these plasmids, which is what they are, they have a lot of activity against the human being and also against animals. And the reality is that it can be a dormant bacteria in the host and not appear until the moment that is triggered by maybe immune suppression of some sort, or even I've seen patients that get into an accident and they trigger infection. It can be triggered by so many different things if it's underlying there dormant. But if you get it normally, as most people, you get a tick bite, you get a rash, and then you develop an acute infection. That's not the Lyme disease that I'm talking about. I'm talking about something that goes beyond that moment, where it wasn't attended, where the patient did not see a tick bite, where it maybe was transmitted through a different way, and that person has a chronicity of symptoms that go round and round, and patients don't know what it is. They visit 10, 20 doctors, and then the doctors are scratching their heads because they believe it's fibromyalgia, chronic fatigue syndrome, ALS, MS, Parkinson, the list goes on. So in the problem with this is that because it's so variant with all those genetic materials, it can mimic different problems, lupus, all the other diseases that I just mentioned. So because it mimics, it is the perfect imitator. Is this age new imitator? This nickname was given to HIV in the 80s because it imitated a lot of diseases. So I believe this is our new, I don't want to say the new HIV because that would be wrong, but it's definitely of the same epidemical proportions. And it can also mean a huge issue, not only economical, for both our countries, Mexico and the US and China, whoever else is involved with this problem, but also of a good, of a big medical bias, because doctors either think that you have it or you don't have it. And I'm sorry, I went further away from what you asked, but the problem with the genetics of this bacteria is that there's hundreds of subtypes. So because there's hundreds of subtypes, the patients respond differently. Because the patients respond differently, there cannot be a one standardized approach. And not only that, but just the category of different stages of Lyme. We know there's early localized, early disseminated, and late stage disseminated, but there probably is a fourth stage there that there's organ damage as well.
Right.
So it's pretty complex. Treatment approaches that I have seen effective is exactly the opposite from the Infectious Disease Society of America's guidelines, which is basically they tell you 28 days of doxycycline is all you need. And this is something that has been proven wrong. And since 2001, there's Monica Ember's study. She did she had patients with Lyme disease, and she gave her doxycycline 28 days. 100% of the patients were sick still after the treatment.
Right. So it's hard to diagnose, difficult to treat. You're located in Puerto Vallarta, but you have patients from all over the world.
Correct.
You will talk to people through the phone, Skype calls, people will travel to you. And I read some reviews online where people have struggled with this disease for 20 years and they come and see you and are feeling better in a matter of weeks. So that's really impressive. How can people find you and get more information about what you're doing?
Hey, they can go online. Probably right now is the most easiest way to spread the information. Our website is lymemexico.com, and you can have all the information there. I'm also an active member of the International Society for Lyme and Associated Diseases, and you can also find me there in their directory. There's a number of incredibly smart and talented doctors also working under that banner, and ultimately my job as a doctor and a part scientist, researcher, is spreading this important information, because definitely this can be a pandemic of huge proportions.
Absolutely. Well, thank you so much, Dr. Morales, for being here. It's fascinating. I'm very impressed with what you're doing within the field of Lyme disease. It's also important to point out you also work with chronic fatigue and mold and other different types of blood issues. So thank you for being here. I encourage people to reach out if they're struggling with Lyme disease.
Thank you very much.
All right, check out Dr. Omar Morales online. He's the founder of the Lyme disease of Mexico. Lyme disease can be a horrible condition that's hard to treat, difficult to handle, really a rough disease for many, many people. So there is hope. I hope you'll check out Dr. Morales online. We have much more Mountain Connections coming up right after this.